Hello, everybody. Oops, there we are. We were hiding for a second there. Welcome to another SOP live production. This evening we have a few people in the chat. I'll get to y'all in just a moment, but we have the venerable Doc Bones and his beautiful wife, Nurse Amy, as well as we got our former compatriot from the former U.S. government. Oh, wait, it's still the U.S. government. Anywho, we got Gil.
Hey,
so, and y'all know me, Comic Relief.
Hey.
So let's see who we have in the chat this evening before we get all started. We got Mountain 8330. We got Howie from Food Forest. We got Uncle Al hiding in the shadows. Michael's here. Miss Kaylin Strain. Jay, Julie, Miss Nina. Discover Sustainable. The chairman. Let's see who else we got. Andrew. There's Dustin. There's Will. All right. So this evening, folks, I'm going to ask you all to hold your questions. Get out a notebook and pad of paper and hold your questions till the end. Take notes. Don't mind Doc and Nurse Amy. They're trying to get comfortable in those very uncomfortable chairs that they have. So hold your questions until the end of the PowerPoint. Then we'll answer all questions you guys have as the best of our ability without going into too much detail. But we'll try to make sure everything is answered. And for that, I'm going to let Doc Bones and Nurse Amy take over.
Okay, well, today we're going to talk a little bit about the bleeding wound, simply because May is National Stop the Bleed Month. That's one of those things that every year we really want to concentrate on dealing with hemorrhage as a problem. Now, this is something that's a problem in normal times. There's certainly a problem in survival scenarios, and we always want people to know what to do, have some supplies that are going to be helpful. We're going to be doing some demos today. We're going to be talking about why things happen, how blood works, and how it clots, and some basic things that are important for you to know. I'm sorry if my voice is a little hoarse. I'm actually recovering from pneumonia, and I am a little foggy tonight, so I do ask for your indulgence. If you haven't heard of me before, or my lovely wife, Nurse Amy, I'm Joe Alton, MD. I'm a actively licensed medical doctor and fellow of the American College of Surgeons, and indeed a fellow of the American College of OBGYN too. And so let's move on. Or you may know us as Dr. Bones and Nurse Amy of doomandbloom.net. Doomandbloom.net has over 1,200 articles, podcasts, and videos on medical preparedness. Of course,
Do you want me to read this?
Yes.
Okay. I'll save your voice for a moment.
All right.
Okay, here's our disclaimer. Any and all information put forth by Dr. Bones and Nurse Amy is for entertainment purposes only and does not constitute medical advice. The practice of medicine or dentistry without a license is illegal and punishable by law. Seek modern and standard medical care whenever and wherever it is available, please.
That's right. Now, hemorrhage, bleeding, exsanguination, all that terrible stuff. The average person sees a punctured femoral artery, and guess what happens? For most people, amazed paralysis. So that's not a great strategy if you want people to live. So you probably have heard of things like the golden hour. The golden hour basically is a period of time immediately after a traumatic injury in which there's the highest chance that you're going to be able to save a person through medical and surgical treatment. Now, with major hemorrhage, there is a little bit of a problem. If you have a severed femoral artery, the average blood flow through the femoral artery is 635 milliliters per minute. A pint is 473 milliliters. Let's say you're there the second it happens and you call 911, and it takes 5 minutes for the ambulance to get there. Well, that's 1.25 pints per minute that they're losing. So in 4 minutes, not 5, but in 4 minutes, they have lost pretty much about 5 pints of blood. And that's about half or more of their total blood volume. At that point, they are in really bad shape, and it's very possible that they're not going to be helped even with the high technology and the trained personnel that are coming for them. That means that people on the scene with some knowledge and supplies have the most chance of preventing a tragic occurrence. And that's where you come in. Now, let's first, I guess, we should tell you what blood is. Blood is the liquid that circulates in your arteries and veins, and it circulates in vertebrate animals. If you're an invertebrate, you have ichor instead of blood. And the purpose of blood is to carry oxygen to and carbon dioxide from the body's tissues and organs. It's not just getting oxygen to the organs, which I'm sure everybody knows, but you also have to have what they call a gas exchange. You have to get the carbon dioxide out of the tissues and organs. And if you don't do both of these things, then you have somebody who's in big trouble. Blood, well, ain't tomato juice. So it has various components, not just pure tomato juice. It's red blood cells, the ones that carry oxygen to and carbon dioxide from body tissues, the white cells. Among other things, they fight infection, clotting factors, which allow blood to coagulate, decreasing blood loss, and plasma, the yellow liquid, in which all of the above are suspended. The white cells are just a little bit. You might see a little graph there where you see the yellow is the plasma, the red blood cells are the brown, and the little gray area is the white blood cells. So you see the approximate percentages there. Let's talk about how blood clots. A platelet is an element in the white blood cell factors that is involved in blood clotting. And when a bleeding vessel occurs, they clump together and try to form a plug, but by themselves, they can't work. You need fibrin. Fibrin's a protein that's deposited around the wound along with the platelets as a mesh, and it strengthens the platelet plug. And the whole thing dries up and forms what we call a clot. It stops the drainage of blood, and it begins the healing process. There are a lot of different things that you need to know about blood, but one of the things is you should be able to identify venous bleeding versus arterial bleeding. Venous bleeding, well, venous blood is, the difference really is the lack or presence of oxygen. If venous blood basically is going back to the lungs to get some more oxygen, so it's depleted of oxygen, it's dark red, almost black really in most cases. And it flows sort of evenly if you had a wound that was just a cut in the vein. Arterial blood is full of oxygen just coming from the lungs and just being propelled by the heart to the rest of the body. It's bright red and indeed comes out in spurts that correspond to the pulse. So you should be able to identify both. The only issue is that, of course, many times veins and arteries run together right next to each other, and you can damage both. Now, there are lots of different types of wounds that can cause bleeding. You have industrial accidents, animal bites, gunshot wounds, all sorts of stuff. Even blunt trauma can cause significant bleeding, enough bleeding to kill you. So it's important for you to know what you're dealing with in terms of what kind of wound it is, and it'll give you an idea of how easy it is going to be to stop it. Now, in the field, trauma assessment has gone through a big, I would say, evolution. Of course, in the old days, it was the CPR standard, which is A, B, C, D, E. A is for airway, B is for breathing, C is for circulation, bleeding, in other words, but circulation. D is for disability, in other words, neurological and things like that. And E is for exposure, open up whatever clothing so that you can fully expose the wound, know what you're dealing with. That has changed. It became call a cab and go. And in this case, in the field, some changes occurred. You wanted to call out for help and communicate the situation. You want to abolish all threats. And that makes sense in a situation where you might be under fire or in some hostile setting. Then instead of ABC, you're CAB. That's circulation first, whether you deal with the bleeding first. Airway and breathing, you could almost assess almost at exactly the same time as the bleeding. And why is this? This is basically because in a survival situation, people aren't going to be keeling over from heart attacks as much as they're going to be stuck in getting into accidents, from doing activities of daily survival, foraging, uneven terrain, hostile encounters, all sorts of things like that. Then N stands for neurological status, or the old disability, and then go to wherever your supply stores are. And that's because you need to get that person from the middle of the woods or in the urban setting to wherever it is that you can have the most chance of helping them. That has evolved even more. Now it's called March pause. And March stands for massive hemorrhage, dealing with massive hemorrhage, then airway control, respiratory support, circulation, in other words, keeping blood pressure going, things like that, hypothermia or head injury. So that's March. And then that's the first set of things you do. And the second set of things, once you're got this person in a more controlled situation, you manage their pain, give them antibiotics to prevent infection, you manage the wound care over time, and of course you splint fractures, provide stabilization to dressings that are on limbs. Interestingly enough, the average adult has 9 to 10 pints of blood, and depends on how big that person is, male, female, height, weight, things like that. And you can actually sort of tell how much bleeding has occurred as a result of the effect of the person, basically how the person is acting. You can certainly lose a pint of blood or a pint and a half of blood or less with little or no effect. Of course, people donate blood, a pint all the time, and do it every 6 to 8 weeks, something like that these days. But you can tell if there is some serious bleeding going on. Indeed, there are going to be some changes, physical changes that you'll be able to recognize. If you lose more than 1.5 pints of blood and less than 3.7 pints of blood, well, you start having rapid heartbeat, respirations going faster, and the skin becomes cool, becomes pale. The patient's usually sort of agitated at this point. And basically what's happening is that since now there's a lot of red blood cells that are outside of the person, what's happening is that you need the remaining blood cells have to circulate through faster. And so that's why you have faster heartbeat, faster respirations. Once you hit about 3.5 to 4 pints, well, then you're really in a lot of trouble, and your body is beginning to no longer be able to compensate and do the things it needs to do. And so instead of keeping that blood pressure up, blood pressure begins to drop, patient begins to appear confused, in other words, losing mental status. Heartbeat is very, very rapid and maybe thready. And once you go over 4 pints, and that would be more than 2 liters of blood, and I have seen many times actually in my career, people with, let's say, ruptured tubal pregnancies or pelvic trauma that have lost more than that, have it floating around free in their belly. Well, that patient is now very, very pale, oftentimes unconscious or unable to respond to commands. Blood pressure now, the body is beginning to give up. It drops further, heart rates and respirations decrease. And indeed, that person goes into shock, if not fully replaced in terms of their blood loss. Shock is a state of inadequate delivery of blood to the body. It fails to maintain the needs of the organs and tissues. And hemorrhagic shock is when the blood loss exceeds the body's ability to compensate and provide oxygen. These people are in big trouble and ordinarily would need some kind of intravenous assistance. At the very least, what you need to do is cover them up because they lose heat very quickly. So Mylar blankets or regular blankets, these are things that are going to be very important. I want to talk a little bit before we get to the meat of what exactly you need to be doing about the theory behind gunshot wounds. Gunshot wounds. Well, it stands to reason that if you're dealing with a person with a gunshot wound, that there's a guy with a gun out there. And so remember, medics out there, that your personal safety is actually much more important than anything else. You are the medic, and indeed you do your group a disservice by becoming the next casualty. So if all threats have not been abolished, you may have to hesitate before you go to help that person. And that goes against your grain. It goes against my grain. But unless you want migraines, you certainly want to stay out of trouble because you are a major asset to your group. The amount of energy that a bullet or any projectile imparts onto a body is called the kinetic energy. And it actually goes very simply by a formula, and that is the kinetic energy equals 1/2 times the mass of the projectile times the velocity squared. The velocity is what's squared. So a handgun round of 155 grains traveling at 1,000 feet per second actually does less damage than, let's say, a 223 round of, let's see, that's just 55 grains, let's say, going at 3,000 feet per second, because the velocity is squared. So you got 3,000 squared versus 1,000 squared. And so that more than makes up for the difference in weight. And as a result, you'll see that entry wounds, when they come in, they actually can be very small, as in this small caliber gunshot wound, but you can see the exit wound is quite severe in this particular case. And that's the way it is in most cases, honestly. And the reason why, and there are a number of different reasons why these things happen. And let's talk about what happens when a bullet actually goes through you. Cavitation. When a bullet enters an object, it forms two channels. Basically, it forms a permanent channel, which is the actual path of the bullet itself going through the body. You can see these are handgun rounds, I think, over here. And you see that a handgun round shot into ballistic gel actually from relatively close range will go more than a foot into there. You see why there was a big blast on the poor fellow's face, because indeed his head isn't 12 inches wide. So the reason why that happened is because of not the permanent cavitation, but the temporary cavitation. There's a shock wave that occurs at the same time that a bullet goes in, and what that shock wave does is it releases the kinetic energy, and it causes all sorts of damage to things that are not even in the path of the bullet necessarily. So you take a look and you can see the temporary cavitation as a wide area on each of these ballistic gel samples, and you see a little line, that's the permanent cavitation. So if I shot you and I missed your liver, for example, by ½ an inch, I could still possibly rupture it because of the shock wave. So there's temporary cavitation, permanent cavitation, and there's also other aspects of it too. There's deformation. The reason why they make hollow point bullets is so that they'll mushroom out. And what those do is they cause a bigger permanent cavity and also shock wave. And so that's one of the reasons why you see you have these hollow points, and that they do a lot of damage. Also, there's fragmentation. You can see that there are actually quite a few rounds that are made to fragment, and this is specifically meant to make a horror story for the medic, because each one of these fragments is forming its own permanent cavitation and its own temporary cavitation as well. And you see the damage is so much more. Now, let's say that bullet just went directly in and hit. First thing it hit was the femur, the thigh bone. Well, it shatters the thigh bone, and what you have is the bullet itself may not shatter or fragment, but the bone certainly will, and each one of those bone fragments makes its own cavitation, both permanent and temporary. So you see how much damage you get, and how much disruption of blood vessels and soft tissue also occur as a result of bullet wounds. And one last thing that happens is many of these bullets just aerodynamically have a tendency to begin to oscillate as they travel in the air. And so as they oscillate, they begin to oscillate more and more and more. We call that yaw. And then they start tumbling head over heels, so to speak. So the yaw and tumble, by the time it gets to you, you may wind up having a tumbling bullet instead of just a very small permanent cavitation. You may have a bullet that's tumbling as it's entering your body. And so you see a lot of issues with regards to damage from gunshot wounds. So should you remove the bullet? Now, of course, and I'm going to give you an example here. And who is this? Can anybody tell me who this is? There's a hint in the right lower corner. Who is that? Okay, well,
we don't know if they're guessing, but they could be in the.
You may be guessing, but
they probably are.
It's President James Garfield. Indeed, President Garfield, and President Garfield, indeed, was a Civil War general, and he wound up being shot. He became president in 1880, and he wound up being shot in 1881 by an anarchist. And what happened here with the bullets, the bullet actually entered the spine of President Garfield. Now, it didn't cause that much bleeding, but it did cause a great deal of damage because of the doctors
sticking their fingers.
Because of the doctors. And so what they did is trying to get out the blood clots that were occurring in there. They wound up having 12 of the best doctors in Washington, D.C. go in there and stick their fingers in and try to get the clots out over and over. And what happened is a massive infection occurred, and President Garfield died in agony about 30 days later.
Poor thing.
By the way, that is President Garfield's spine right there. I actually had we saw the honor of visiting his spine at the National Museum of Medicine, and the bullet is still in it.
That was in Washington, D.C.?
That was indeed.
Yes.
Okay, well, but the question was, remove the bullet. And the answer is, in normal times, yes, they will most of the time remove the bullet or every fragment they possibly can. In use, survival medic will not be removing the bullet unless it is right there and it is not impinging on any serious, important structures. And the reason is because the body has a tendency to recognize it as a foreign object, will form a wall around it over time. And so the odds are best that you don't go digging like those 12 doctors did into your victim, your patient, and wind up having them die as a result of an infection, which is a bad way to go. How about a knife? Should you remove the knife? Now, most people will say to not remove the knife, right? Well, and that in normal times, that's absolutely what you should be doing. You should not remove the knife. You should definitely pack the knife. What you need to do is you need to pack it in a certain way. You want to have support on either side with blanket or dressings of some sort.
I think we used rolled up pillowcases here.
Rolled up pillowcases,
yeah,
and then you see that the knife handle. You see that we have stabilized that knife so that it is in place, so that person can get to the hospital. But you, survival medic, do not have a hospital, and so therefore you are going to have to remove the knife at one point or another, but not at the site of the injury necessarily. You want to go and transport this patient by probably supporting the knife in place just like that, and get that person to where the bulk of your medical supplies are, so that you are in the absolute most controlled setting, because that knife may be pressing on a blood vessel and preventing it from bleeding. And so these are very, very important things that I think that you need to know.
Okay.
Whew. Okay.
All right. Now let's change spots.
Okay.
So I can sit there.
And now for something you really like.
I think this will be easier. There we go. All right. We're still going to have some slides, but then I'm going to be doing action in between. So first of all, we all, after especially 2021, our heightened awareness of protecting ourselves, protection of our hands, our face. And just here you see some pictures. It's actually a old slide that I've always used. It's got different kinds of gloves. All of the gloves that you see are nitrile. We do try to keep non-latex. Actually, one of the sterile pairs I see is a latex, but I don't carry any of those. I don't put any of those in my kits. We only use the hypoallergenic because there are people out there with latex allergies. So if you're going to make first aid kits, if you're going to have trauma kits, you're going to be touching people that you don't know, and therefore you don't know whether they have latex allergies, please try to stock up on gloves that you know are not latex. And there's a few different types of brands, but nitriles, I'd say, the most popular. So you want to make sure that you have hand sanitizer, some kind of maybe even BZK wipes. Alcohol wipes would do in a pinch. But if you can get your hands clean before you put your gloves on, before you touch the person on as fast as possible, that's what I want you to do. Let's see where the next slide is. I'm going to pull this up. Yep. Here. There we go. Okay. Just see where the red thing is. All right. So real quick, we're going to review these. I'm eventually going to get up and show you exactly what to do. Just give me a few seconds to go through some slides, and then we'll do some demonstrations. First things you're going to do, again, put your gloves on. You're going to want to cut away clothing over the bleeding area. We'll go through each one of these individually, but just a nice review. Put your gloved hand on the wound and apply firm pressure. This is a theme. Joe's going to say it's a theme.
The thing.
Next thing, apply a dressing or a bulky material to the bleed and apply firm pressure. If you have a medical kit, try and get the dressing out and the bulky material out as soon as possible, because it is preferable to have something between your gloved hand and the bleeding wound. It just helps with stopping the bleeding. Your bare hand is not as good as something, and I'll show you some alternatives if you don't have a first aid kit. But get out any kind of gauze you have. We have several different ones. Just real quick, we have 4x4s. We have a triangular bandage. We have a sheet that's cut up. It could be your t-shirt. We have some roller gauze. And there's some other pads in here. So it doesn't matter is the whole point. You just need something. Next thing you want to do, after you get the dressing on and you're pushing on it, if it's not working, you can try to elevate the wound. This is going to work better on arms because you can get them higher. It's going to be a little harder if they're legs. But if you can get something underneath the feet and elevate the leg, anything you can do to slow down the bleeding is great. And you're, again, going to apply firm pressure.
Right. See a pattern here? Firm pressure.
Firm pressure, firm pressure, firm. Okay. So your first step will be put on gloves. Your second step will be expose the wound. So you're going to need some shears like this or anything. I don't care if you carry a pocket knife, whatever it is, you need to expose the wound. Remember when Dr. Bones was talking about gunshot wounds, especially, not only are they probably going to have an entry wound, but they're probably going to have a worse wound on the other side. So you might see a little bitty hole right here, and then the other side has this nice blast, depending on, of course, how fast and how big the bullet was.
I just want to say that if you are shooting somebody that is crouched and as they're approaching you, you're shooting them. You could be shooting them in the collarbone area, and the bullet can come out their butt.
Right.
Or their rear
ricochet.
End, their buttocks.
Ricochet.
As they say.
We need to move your chair up.
So,
you're in my little tiny chair.
No problem.
Okay. So expose the wound. Make sure you get the clothes off. You see everything that's going on. EMTs are really good about this. They basically disrobe people when they come upon, especially trauma victims, because they know there can be things all over the place. There might have been shot in the knee and then it came out, who knows, the bottom of the foot. So you need to look around. The first wound you see may not be the only wound. I just want to emphasize that. There you go. Just what we were talking about. Get the clothes off. See what's front and back and sideways. We just showed you the dressings. Again, anything will do. Put a dressing between your hand and the wound. It works better than just your fingers. If you just have your hands, it's all you got. You're trying to save a life. It's okay. Be aware that when someone's bleeding and you don't have gloves and you don't have hand sanitizer, and you really do want to save a life, you are not going to get any diseases through your hands. I just want to tell you that, unless you got all kinds of cuts and blisters that are open, wounds on your own hand. If your hands are intact, which I don't have too many things going on my hands, I could put my hand in a bucket of blood. I could take it out. I'm not going to get any diseases. So if you really want to save a life, you don't have gloves, it's okay. Get your hand in there. If you really want to be a good citizen, just go for it. You might save a life. Okay, so alternatives to gauze.
We're not too picky.
We're not too picky. We're definitely not too picky. Let's see. Socks, underwear, shorts, a bandana, a scarf, any kind of of towel, washcloth, any kind of t-shirt. You just want some material. So if you can take something off or find something that was in your car or nearby, again, something between your hand and the wound, you're really going to do a better job at stopping the bleeding if there's some material there. How to apply direct pressure. So I'm going to stand up now. I have a little demo over here. Let me get this in here. You can just back up for a second, babe. Okay. Sorry for all the movement, but I want this to be close so you guys see this. Okay. So this is my wound. The patient's bleeding from this side because that's where the heart is. And let's say this is an arm and then the elbow is right underneath here. So it's an upper arm wound. So we're going to pack this wound. Get your gauze if you can possibly. Pack it in towards where they're bleeding. Remember, this is my upper arm. So this is where the blood is coming down and it's coming out probably from a vessel up here and squirting out. So do I want to pack down there? No, I want to pack towards where that blood is coming from. So we're going to take the gauze and we're going to slowly push it in and keep pressure. You see where my other finger is? I'm exchanging this. I'm adding to it and exchanging, but I'm continuously putting pressure here. You can do that with your thumb. You can do it with your finger. You can do it with 2 fingers. It doesn't matter. You're adding more gauze slowly and then putting more pressure as you're packing up the wound, but you're keeping the pressure towards where the blood's coming from. The blood is coming from this way. So we're packing it in and we're adding more. And you see we're adding it sideways. We're not adding it from the bottom up because generally speaking, the blood is not coming from the bottom. It's coming from the heart. The heart is pumping it and it's coming out here. So you want to maintain pressure towards the bleeding vessel.
Now,
once you've done that, then you want to put 2 hands over it. And you want to push and you want to straighten your arms up. Honey, lift this up a little bit so they can see me a little better. Okay. So I'm going to get over this patient and I'm going to put all of my weight onto that bleeding wound as much as possible and hold it and hold it and hold it. And we're going to pray that it stops. But we're going to tell you what happens if it doesn't stop. Okay, so that's how to pack a wound. And that's how to apply the dressing.
I just want to say, if this gets soaked, what you would do is to go ahead and, since this is a regular dressing, you would go ahead and add a dressing.
You can
on top of it and just keep packing. Don't take the old one out. Keep the old one in and just pack on top of it.
And I want to have a caveat. If it's minimal, if the bleeding is not bad, that's fine to do. And we're going to talk about when you decide that you're going to be just doing dressings and pressure and when we're going to be putting a tourniquet on and when we're really in some panic mode here because it's life-threatening bleeding. But right now, what I was just showing you is some minimal bleeding. And yes, if 2 things, if the wound, is still oozing a little bit, not a lot of bleeding, oozing a little bit, you can add a second packing to it. Or if the wound is bigger, you see my dressing only filled up a small wound, but if your wound is about this big, you might definitely need a second packing in there. And then you're on top of it, you're pushing hard, you're putting pressure on it. And the next one. Again, we talked about in that little summary about elevating the extremity. Once you've packed the wound, you're putting some direct pressure on it. Get it up if you can. Okay, it's harder for the heart to pump out blood when it's raised. So maybe that'll work. We're trying to do things when it's not life-threatening, blood is not pouring out. Again, I'll show you those parameters of what you're going to be looking for. So quick review. Put the gloves on, cut the clothing away from the bleeding area, put your gloved hand on the wound and apply pressure if you don't have any material. If you do, apply the dressings or bulky material to the bleed, apply firm pressure, elevate the wound with firm pressure. Hopefully those will work. However, if blood soaks through that gauze that we have packed in here onto that wound, and you're holding it and you're seeing blood start to come out, we're going to need to move to a tourniquet because this is not effective. Okay. We want every drop of blood staying in the patient. Every drop of blood, like the red blood cells that Dr. Bones was talking about, carries oxygen. So we want all the blood that we can staying in the patient, not on the floor. Okay. Things to look for that you need to skip packing a wound and putting pressure on it is if blood is spurting out, if the blood is pouring out, if the clothes are saturating with blood rather quickly, amputation, something's cut off, you need to put on a tourniquet. It's going to be difficult to stop bleeding, even if it's a pinky. You know, I mean, you may need to put a tourniquet on up here just to get them to the hospital. If the victim is becoming disoriented, confused, or loses consciousness, again, we're starting to have those blood loss amounts that he was talking about. More pints and more pints and more pints are going to cause more problems, and you're going to notice those. You may come upon somebody who's already unconscious. I would not be doing direct pressure with someone like that, or someone who's looking, you know, like they're going out of consciousness. You need to get the tourniquet on. Something's going on. And it's okay to put a tourniquet on. We have turned such a corner. 10 years ago, it was taboo. We had the Boston bombing. There was a bunch of saviors that were around, angels, miracle workers that were able to figure out how to use tourniquets even when they didn't have tourniquets and save lives. Even though people lost limbs, they were still alive. The government realized that we need to all learn how to stop bleeding, and that's why we're teaching you guys this. It's not a bad thing to use a tourniquet, especially in modern medicine, because for most of us, how far away is a hospital really? Even if they have to evacuate somebody within a safe amount of time, which military has determined, 120 minutes or 2 hours. That there's very few people that will have any kind of long-lasting ill effects with a tourniquet that's on for 2 hours. So you have a safe period. So don't fear putting a tourniquet on, especially now. The ambulance is on the way. Somebody's coming to help you. They'll get to the emergency room. The doctors in the surgery or surgical suite will figure out that they want to take it off in that safe environment. So don't fear putting it on. It's okay. And they may take it off 10 minutes after they get to the ER. That's okay. Better to overtreat than undertreat people who are hemorrhaging anytime. These are some commercial tourniquets that are made. I do have all of these, and I will be showing you how to use some of them. But they are the Sam X tourniquet, XT tourniquet on the top. That's made by Sam Medical. Those are people, the Sam Medical are the same folks that make Sam splints. You guys might be familiar with Sam splints. The soft tourniquet, SOF tourniquet, or tactical tourniquet, is by Tactical Med. I also have both of those, the orange and the black. I have the cat tourniquet. That's a Velcro base. And then we have the SWAT, which is stretch, wrap, and tuck. So I'll be showing you some of those. But those are very handy, great to have in your kits. Put in your glove compartment, especially the SWAT T is super small, very easy to throw in a glove compartment, and it's multi-purpose. We'll be going over that in just a second. I think I skipped one. Here we go. Just here's some principles. This is not how to put on each individual tourniquet, but just some principles to think about. And again, I'm going to re-emphasize that the bleeding is obviously pouring out arterial, the bright red that Dr. Bones was talking about. Consider the tourniquet as the first action. Okay, the first action. So put your gloves on, but get that tourniquet on as soon as possible. It should be wider than 2 inches. So if you're thinking about doing a MacGyver situation and you might want to use something like a triangular bandage, just make sure the way you fold it, that it stays thick enough that you're not creating a rope-like burn or tie into somebody's arm and possibly causing tissue damage because it was too thin. So think about what you're using. Make sure it stays nice and thick and again, isn't rope size. You don't want to hurt them. Always place it 2 to 4 inches above the bleeding area. Now, where you don't follow this is if, say, you get an injury just below the elbow or just below the knee or possibly on the top of either of those, you're going to move above. You do not place the tourniquet on a joint. So you will not put it on a knee and you will not put it on an elbow. If the injury is too close to those, you're going to go above that. You can go just above it. You don't have to go 2 to 3 inches above the joint, but you need to go above the joint so you can actually get the compression. You won't get the compression over the joint. If you're under fire, we're talking about gunshots, hostile situations. There's still gunfire going on. There's still bad people out there. You manage to grab the person, throw them to the side, throw a tourniquet on them. Do not worry about entry, exit, gloves, all of this other stuff. You are under fire. Put it high and tight. The military does this.
And over clothing.
Do not worry about cutting clothing off. So if you know that there's somebody bleeding in their arm, you're going to put it high and tight. Okay. If they're bleeding in their leg, you put it almost into their groin, that high. So high, it's just below the buttocks. And you put it as tight as you can, high and tight, because you do not have time to worry about the exact location, cutting the clothing off, and all the other steps that we've just discussed. You're trying to save their life while you're trying to get the bad guys, out of the picture. Once that's calmed down, then you will turn your attention to the person. But this is a temporary thing, a quick, let's get it going. Keep the blood in the body. We'll deal with that later.
Can I add something real quick?
Yes.
You may cover this later. I didn't catch it this time because I'm trying to read the chat. But anytime you apply a tourniquet, write the time you put the tourniquet on. That way, if anybody's following behind you, they know exactly how long it's been on there.
And I'm going to show you where
that you're allowed to have a tourniquet on. I'll shop now.
Yeah, that's okay. Yeah, we did talk about the 120 minutes. Each tourniquet has a place to write. And when I show you the tourniquets, I'm going to show you exactly where to write it. And I have a slide that says, don't forget to write the time. It is super important. We have a time limit. I'm also going to talk about transitioning from the tourniquet and getting it off and how you can do that safely in a little bit. Okay, so we've done, now again, these are principles about tourniquets. This is not precisely how to put each and every one of them on and tighten them. When you put a tourniquet on, you want to make sure when you tighten it up that you can't put 2 fingers underneath the tightened strap. And when I use Dr. Bones for a demo in a few minutes, and I kill his arm because I'm going to be tightening it, I will show you when I pull the strap that you shouldn't be able to put 2 fingers on it. This is before you turn the windlass on the tourniquets that have windlass. You shouldn't be able to put 2 fingers on it because the strap needs to be tight first. Again, but I will show you that. These are just principles. And then when you tighten any tourniquet, you're looking for 2 things. 1, the bleeding stops, and 2, the pulse stops. Now, it may be difficult to feel this. You're under stress, somebody's bleeding, you want to save their lives. Taking a pulse sometimes is not easy for anyone because their pulse is thready or whatever. I mean, mine's hard to feel. It just depends on the person. But those are the 2 things you'd like to see. If you can only see the bleeding stopped when you have turned it and tightened it, that's great. If you have a chance to check the pulse, even better, because then you know you've really done a good job. Okay, so let's talk about the cat tourniquet. I think it's one of the most popular tourniquets. A lot of police use them. A lot of military use them. It's probably one of my most requested, most purchased tourniquets. Has a few different parts. It has something called a self-adhering band, but as we all know it, it's Velcro. You know what? Let me use my orange one. I'm actually going to open up a tourniquet for you guys that we went and got today from our office. By the way, keep your tourniquets out of their plastic. You can practice with them a little bit. It's okay. All right. So this is the orange one. So the parts here are the windlass clip right here. That's where this windlass is going to be placed after you turn it around. You have your strap, which they call it a self-adhesing band, but we all know that it's just Velcro. That's what's going to tighten up on the arm. You'll be turning the windlass rod. It will be put into the windlass clip. Let me just show it real closely. After you get it on the patient and you are sure that the bleeding has stopped, you will complete it by taking the strap, putting it through the windlass clip over the bar. So it's inside of there, over the bar. And then you take the windlass strap and you put that over. And guess what that says right there? Time. So you will take a marker. Hopefully you have something that's indelible, permanent, and you will mark the time right here. It's not a bad idea to put a T on someone's forehead, especially if you're passing them off to someone else. If EMT is coming, that says there is a tourniquet somewhere on this person, because the person might get covered up with a Mylar blanket, and people might be busy doing other things. You put the T here, they will know there is a tourniquet on this person. And let me show you. Go ahead and sit down.
Oh, I was going to give you my arm.
Nope, I just want you to sit down.
Okay. All right.
I'll turn this down a little bit. Okay. Bend your elbow here. All right. So let me undo the tourniquet I just did. You always want to keep your tourniquet set up so this windlass strap here is not covering this. So when you set it up, if you've practiced with it, always make sure you move this back, because you're going to want to grab this real quickly and that will be in your way. Now, if you have to go under somebody's leg, hold on one second. If you have to go under somebody's leg, you can take this off, feed it underneath their leg, and then come back around. All right, that's why this is here. When you're placing it on somebody and you are the rescuer, you want to make sure that the strap is towards you. You see how I can pull this? If I had the strap on the other side, it would be difficult for me to pull this. You want to pull this nice and tight, secure it, and make sure you can't easily put 2 fingers underneath there. You want this nice and snug before you begin to move this. Now I'm going to loosen it a little bit so I don't kill him. And then you're going to turn this. It may take 2 hands. I'm only going to do it once so I don't hurt him. Now, this is going to pop into the windlass clip right here. And remember, when we're sure that the bleeding has stopped and there's no pulse, we're going to bring the strap around, cross it inside the windlass clip, over the windlass rod, and then we're going to secure everything with the timestamp and write the timestamp. So that is how you place a cat tourniquet. Just like that. Now, if you have to do it to yourself, I'll demonstrate myself. You know how I had the strap going towards me? Now we want to have the strap. Lose you?
No computer problems.
Okay.
There,
Okay.
better.
Good. Okay. Can they see me? Should I go over here? All right. All right. So if I have to put this on myself, I've slipped it over my arm, moved it where it needed to be, pulled the strap towards me. Now, see, I can pull it. If I put the strap the other way, that's difficult. So you need to pull it over your chest. That's where you want the strap. Nice and tight. You want to secure it to the back, because remember, you're going to have to bring it around. Then you're going to let go. Then you're going to tighten this up so you see your bleeding stops. Pop it into the clip here. Bring the strap around. Put it over the windlass rod. And then secure the windlass strap. If you happen to have a pin, write the time. If you don't have a pin, look at your phone. Try and get an idea of what time it is, because, again, you only want to keep this on for a maximum of 120 minutes. Okay, so that's how you apply to yourself and to someone else. And somehow we got back to direct pressure.
Keep going. Okay. Keep going.
I'm getting there. This is directly from North American Rescue, and it's instructions, and it's exactly what we just talked about. How to put it on yourself. You notice that in the top on number 2, he's pulling the band tightly across his chest, and he's making sure that he can't get 2 fingers in there. He's turning the windlass, putting it in the clip, pulling that strap back over the windlass, and then securing the entire thing with the windlass strap. So that's their own instructions. Okay, soft T. This is an older version, but this is what I love. This has trying to get in the right. This has a buckle that has teeth. I'm trying to get this right. Okay. There we go. Has teeth right here. And when you pull on the strap, it tightens up and you can't reverse it. This actually clamps down so heavily on this strap that you can't reverse it, and you don't have to do Velcro. You notice that? It's just a pull. This screw is a safety screw. When you are done with your tourniquet application, if you turn the screw down like that, this cannot be released. You cannot push this open. You cannot open up the strap. So if anybody hits this tourniquet, it's not going to loosen up this strap. And also, there's no Velcro to come undone. So this is why I particularly like this one. So let me loosen up the screw. I'll show you real quickly. It's very similar. Again, slide it on, tighten it up, do the windlass till the bleeding stops. Now this one has a triangle. This one right here is a locking mechanism, and it has 2 of them. So depending on you've put it on somebody else or they've put it on themselves, you have 2 sides to lock it. All you have to do is bring one of those triangles down over the windlass, and then to screw it. Now it won't come off. There's no way this is coming off. To release it, you unscrew it, pick this up, and by lifting those teeth right there, you can remove it. So anyway, this is the soft T, SOF.
And these are 2 tourniquets that are popular with the military.
Yes.
And very, very effective, especially because you can use them on yourself with one hand.
Right. Okay, let me show you real quickly. Okay, so this is the package for the SWAT. Very compact. If you look at my hand with it, it's super small, super thin. It's really lightweight. It's actually multi-purpose. This can be used to hold on splint material. This can be used to hold on gauze, wrappings. It can be used as a sling also. So it's very multi-purpose. I should keep going the wrong side. But this is what it looks like. If anyone's ever used an exercise band, I think the emergency room doctor who invented this probably saw his wife exercising. The name of it is SWAT, stretch, wrap, and tuck. Very simple. Those signs that you see on there, the shapes, the squares, the circles, the rectangles are to eyeball how tightly you are putting this on. I want you to see as I stretch this that these rectangles turn into those squares and that oval turns into that circle. So keep an eye on that. Ready? There we go. So that's what you're trying to do. That's how you know you've put this on tight enough. This is more easily put on other people, but you can put it on yourself if you have a little experience. I hold this down. This is my trick with my thumb. You see this in place. Pull one piece around. Go back around. And now when I pull this, it actually self-adheres to itself. It has a texture on it that holds it to itself. So I can actually apply this as hard as I need to stop bleeding. And when I am done wrapping it, you're going to tuck one edge into a fold like that. And that's it.
All right. Now,
so I do it harder than that. But
I have something I say about the SWAT.
Okay.
And
here you go.
I want you to look at the slide, and you see me applying the SWAT there, and you see how much I am stretching it. And that is a lot more because, of course, we don't want Amy to hurt her arm.
Yes, thank you.
A lot more.
I need my blood circulation.
Yeah, right. It's a lot more than what you would ordinarily see. And you sometimes see people criticize the SWAT tourniquet because they believe they can't lose the pulse, and they worry that it won't stop the bleeding. But that's because they are not pulling tight enough. You have to remember that having a tourniquet in place is supposed to hurt. It's supposed to be really, really painful if you're doing it right. So the SWAT is an excellent. I think you should have one of the two military tourniquets and several of these SWATs, because they're so versatile and they can be used for so many things.
They are versatile. So that's the whole point. They can hold on splint material. They can be a sling. Where'd it go? I threw it in.
Are you lost it?
No, the one I was just using.
Here.
Did I put it on the floor? Okay. Look. I just made a sling. I mean, it's so incredible. It can hold on gauze dressings. But anyway, it's one of those things with preppers that it can use A, B, C, D. So I really like it. All right, moving on. Here we talked about the SWAT. Again, you see at the bottom some of the other things that can be used for. Also an ACE bandage. So if you have somebody who's sprained an ankle or has a knee that is starting to go out because they've been walking so much, that will help them. So it's got lots of good things. Alternative tourniquets. I've seen videos with screwdrivers and triangular bandages holding it on. We actually did an article for a magazine where we did some of these MacGyver moves. But if you're going to use a blood pressure cuff, it depends on the person's arm size. If their arm is really big, you're going to need a super large tourniquet. So you need one of those extra large tourniquets. I keep saying tourniquet. Blood pressure cuff. So blood pressure cuffs come in a couple different sizes. There's also pediatric, but you're going to need the biggest one you can because the longer ones have more Velcro to hold them in place. When you're pumping up the blood pressure cuffs, they explode like balloons. So if you pump it up to what we're saying you need, 200 for the arm and 250 for a leg, that's pretty strong. If anyone's had their blood pressure done, generally they don't go that high, and it hurts when you get to be 180. So that's really strong on this, and it needs more Velcro to hold it in place, or the Velcro is just going to start peeling off when you get to that. So make sure you have an extra large size blood pressure cuff if that's what you're going to use it for. Okay, so we have put tourniquets on. We have put pressure on. We're still bleeding even after the tourniquet. So reasons why people start rebleeding after a first tourniquet. There's something called loss, tissue loss, pressure loss. It makes perfect sense. Once you compress tissue, there's no more blood that's flowing underneath there. And what happens is the tissue loses its volume. And so it shrinks a little bit underneath the tourniquet. So pressure loss is pretty common in these military tourniquets. And so their solution in the military was to add a second tourniquet. And where you add that tourniquet is above the first tourniquet. So when I say above, I mean closer to the heart. Okay, anything that's closer to the heart is going to be working better. So you're going to put one above it. So if it's on the leg, you put it closer to the groin. If it's on the arm, you put it closer to your shoulder. So you're going above it for a second tourniquet. If you don't have a second tourniquet, you're going to need to reevaluate the first tourniquet, and you might have to tighten it a little bit more. Again, 2 signs that you know you've got this tourniquet on good. The bleeding stops again, or hopefully it didn't start in the first place once you got it on, and then there's no pulse. If you don't have a second tourniquet, which is why that SWAT tourniquet is always handy for the second one, move on. If you have 1 to 2 tourniquets in place, but you are still bleeding, whatever, it's just so bad, you're still bleeding, you've got 1 that's super tight or 2 and it's just not working, you need to get the gauze out that we had packed. And the reason you're taking that out is because the hemostatic gauze that you're putting in has to have direct contact with the bleeding blood vessel. So the bleeding blood vessel has to have contact with that gauze. So just willy-nilly shoving it in, again, to the bottom of the wound or even towards the fingers or the toes is not going to help you. You have to pack it exactly the way I showed you pack this. Here's the heart. Here's the upper arm. It's bleeding this way. You're going to pack it this way. You've got to get this initial gauze out because it's in your way. But there's also maybe some blood clots that are formed or just some goopy blood in there. So when you take it away, you're going to swipe out any blood that's in there and make sure there's nothing left. Then all you see is that bleeding blood vessel. And you are going to repack that area with one of your hemostatic dressings. Here's some options. On the next slide, we'll show you. But you're packing in the same principle as how we pack the wound, towards the bleeding blood vessel, towards the shoulder, towards the groin, always towards the heart. It's hard for me to see these red ones.
You want me to do?
Here we go.
Okay.
It's so tiny. Okay, so here's some hemostatic gauze. We have Celox, Chitosam, which is actually one of my favorites. Chitosam is the same product as Celox. This has some little granules that are stuck to a gauze. So it looks like gauze, but there's some granules on it. They wove those granules because it's the same product, but they made it look like almost like diaper material. So there's no granules in it. Nothing's going to fall off as you're putting it in. It's super smooth, but nice and thick. And I have to say, this is one of my favorites. Everyone can have their favorites. This personally, I've used this for cuts. We've used knife cuts on our fingers. I've used it for nosebleeds. It's 100% effective for us. I love this product. Did you want to say something?
No.
Okay. I'm giving him options. This is a smaller Quick Claw, but everyone knows that name. And it was nice and big on this. This is a smaller version. This is a 4-foot. Now, don't get confused because they have a 12-foot. I'm sorry. Yeah. So one says 4 feet and one says 4 yards. So be careful. This is the 4 yards one. But it's also commonly known as combat gauze, but it's also Quick Claw. So they both say Quick Claw. This is the military version in the green. I believe they also have it. It comes in a red one too. Every once in a while they give me the red one. I don't care as long as it works. So those are the 4 you're seeing in the picture. We did those, all of them.
Okay, good.
Okay. So how to use them. Again, we just talked about that. Firmly press towards what? The bleeding blood vessel. Here's the heart pumping the blood out. So we're going to pack this way. And I showed you how to do that. Remember, never take your finger or thumb out. You're adding it. Important thing. Do not forget. You are going to compress this. Again, after you pack it, put both your hands out. Stand over it. All of your might. You're really pushing hard. Give it your best. You want to save this person's life. 3 minutes. 3 minutes for any of these products. At least 3 minutes. It may be a little longer that you need to do it, or you just want to because you want it to work really well, but a minimum of 3 minutes. These don't cause burning and they wash out easily. And that's always questions I get about these. Oh, is it going to hurt the person? There are earlier versions. Those were oranges. These are apples. Okay. Those earlier versions that caused all these problems, they caked up, they wouldn't come out. They burned people. They hurt people. They caused more problems than they helped. They don't exist anymore. These products have nothing to do with those, okay? Wash out easy. Don't cause any injuries to the tissue. Again, we're reaffirming that we're applying pressure, the gauze for 3 minutes. I just want to really pound that into your head. If the bleeding has now stopped, okay, we put the pressure on, we put the tourniquet on. That didn't work. We had to put a hemostatic gauze in. It's a miracle. The bleeding has stopped. Depending on the size of your wound and how much your hemostatic gauze was able to fill up this wound, you either have to add more gauze on top. So open up another roller gauze, compressed gauze, whatever it is, and pack that in also towards the bleeding wound. Fill up the wound. So if it's this big, one of these gauzes may not be enough. So you may have to put some more gauze, packing it in to fill it up. You want to fill it up till it's at the top. Okay. Then we're going to cover it all. And that is, where am I? Here, right? Hard to see. I remember we're on slide 47. Okay, so we're going to cover this all. It's like putting the mozzarella cheese on the lasagna. Okay, we've got our little layers underneath there. There are choices of pressure dressings. There's the Israeli dressing, also known as the emergency bandage. I have to go this way. And this is actually double packed, but we already have it opened for us. There's a mini one. There's several of these on the market. There's a mini compression bandage, which is actually, a little bit smaller packaging. It's a little flatter. It's not quite as big, and it doesn't have what's called a pressure bar. And I'll show that to you when we do the Israeli bandage. Here's the version for lay people. This is the military color. It's the same exact thing, except this bandage is a little bit whiter. It's more of a cream color, but it's the same exact thing as this one. Same company, same exact process. 48. Okay. All right. Again, here's some other pictures. The one in the lower right is an Oleus bandage that has a little cup on it. Looks like an eye cup. And when you cover that cup pushes down into the wound and causes extra pressure. So the top two are the Israeli. The lower right is the H&H mini compression, and then Oleus is the bottom. Okay. This is from the company that makes Israeli dressings. And it's very simple, and I'm going to show you how to do it. You're going to take the pad. Now, these are wound up very special. Let me turn this down a little bit. These are wound up very special. There is a thread that is in this. So when you take it out, this part right here, which is the long elastic part, will not fall to the floor. It's got a string in here. So this part, which is what you're going to be wrapping around the patient, has a string. So if you accidentally let go of it, it won't fall. Inside here is a nice cotton pad, and that is going to go over that gauze and the hemostatic gauze that you have packed. So let me have your arm, honey. We're going to pretend that he had a wound here. We have tourniquets on, not on the joint, tourniquets on here. We had to put hemostatic gauze in. It was a little bit bigger, so we put extra gauze in. Straight over it, okay? Come around. The first time you encounter this clip, the pressure clip, you're going to go inside of it. There's a little opening. I think you can see that right here. So I popped it inside of there. Pop it and reverse it. It's like a dance. Pop it and reverse it. Now we're going to reverse it, and we're going to wrap down a little lower than that pad was, so nothing drips out of here. And then we'll go over that pressure clip a little bit more. You got quite a bit of wrap. And we'll go over the top of it. We're getting lots of protection. We're getting lots of pressure. Got lots and lots of wrapping we can do. At the end, you have the clip. Okay, this is your secure clip. It's almost got like fish hooks in here. When you put it on, you're going to just pick up a piece of material. Here we go. And you can just clip it right on. You don't have to do two sides because that will hold it. I didn't make it too tight on him, but that will hold it. It won't come. Even if I pulled this really hard, it wouldn't come. Another thing you can do, if you really feel that you need extra pressure, let's say you did not put the tourniquets on, you just put gauze in it, but you're a little concerned that it might start bleeding again, even though it was kind of mild, you can always lift up a piece of this wrap like this, stick the clip underneath it, and you can twist it. And what that does is it puts additional pressure on that wound. So now you're really sure it isn't going to restart bleeding. And then, of course, you take that little fish hook piece, find another wrap. Here we go. And then stick that right in there. Now I can let go of this and it is not coming off. You see that? It's staying.
According to the company, you can get up to 30 pounds of pressure from this.
And it's not easy to get off once the fish hook is on there.
I'll do it.
Okay.
I'll do it.
There you go. All right. So that's how to do an Israeli pressure dressing. Again, the small one doesn't have that clip to pop it and reverse it. It's just a wrap, and then it's got the secure clip at the end. Okay, let's move on. Write the time and date. Yes, every tourniquet has a time and date on it. Now, the SWAT tourniquet in the package that it comes in, actually, where's the package? I had it. Actually has a time band, almost like a bracelet for the hospital. So you can write the time and date on that one. The other tourniquets all have them in sort of different positions. Some of them have them at the end, like this one has it at the end. So it's at the end of the strap here. So it just depends on what tourniquet you have, but they all have the option to write time and date. Okay, we've stopped the bleeding. We've covered everything. We've got the Israeli bandage on it. But if you move that wound, let's say you want the patient to walk or they're being thrown onto a stretcher, moving the wound can cause rebleeding. So what you want to do is you want to put a splint on. And Joe, let's see if we can get this out of the way. So I bent it so it was under his arm comfortably. I molded this before I put it on. I bent this around his arm so it makes it a little stronger. Bending SAM splints makes them stronger. So I made this underneath his arm because he has an upper arm injury here. And then I will secure this with either one of these, some gauze. I can use a triangular bandage because those are nice and big and have multi-purpose. I can use torn up pieces of t-shirt. It doesn't really matter. You'll secure it. Be careful. If you feel like this tie around it is touching the patient, put a little pad here so the patient isn't feeling it. Anytime that a SAM splint or any splint is touching a bony prominence like a wrist or a thumb, you want to put a little padding there. This is okay because I have it underneath his arm. I don't have it jammed all the way up there, and it's gently on his elbow. And then another thing I would do is then I would put a sling on it, and I would keep his arm here. So I put a sling around his neck, and then you can put one around his chest. Again, gently, something that's stretchy would be nice just to keep this in place. The less this is moved, the less chance we're going to have of rebleeding. Okay. All right. Continued care. After the wound has been treated, is that where we are?
Yep.
Okay, I just want to make sure. After the wound has stopped bleeding, it needs frequent reassessment. Remember, we talked about pressure loss. At any time, even a wound that's got 2 tourniquets on, it's got a hemostatic gauze, the body just might reject the clot and not work, and it just starts rebleeding. Maybe he moved too much, or the clot got dislodged that the hemostatic dressing or hemostatic gauze caused. So it's possible that it can be released. Cover the patient up to help prevent heat loss. We're trying to prevent shock. You want to raise the feet up about 12 inches if they're laying down to keep them warm. You want to speak calmly. You want to speak, yes, everything's going to be fine. Don't you worry. I'm here for you. It's going to be okay. You don't want to freak the patient out. Oh my God, your leg's blown off. You're going to die. These are like the worst things you can say to a patient. Everything's fine. In the military, you'll see the movies, the leg's in a million pieces, and he knows the guy's got 5 minutes, and he'll ask, oh, it's fine. You're going to be just fine. Keep the patient calm in spite of everything. You don't want their last moments, if they are going to pass, to be absolutely horrifying. And hopefully you are telling them the truth and everything's going to be fine.
And the more agitated that the patient gets, the faster the heart rate, and the more blood
are going to pop out.
Faster the blood's going to come out of the body.
And the more likely they're going to hit a shock situation. And keep themselves warm. So by covering them, what you're doing is now you're not seeing the wound. So even though you cover them, you need to lift up that mylar blanket or wool blanket or a jacket you put over, whatever it is that was covering this patient. You still need to look. You need to look frequently, not every 20 minutes, but maybe every 2 or 3 minutes. Because if they do start bleeding, you don't want them to lose a whole bunch before you catch on to this. So keep a good eye on them. This one?
Mm-hmm.
Here. Okay. In normal times, of course, like he was talking about, call under cab. It was call, right?
Call
911.
Call
for help. If you are off grid, get the people who know what they're doing around you with their supplies, so everyone can get this patient to the main area where all the supplies are. You need help. Again, keep calm, reassure them. We're going to talk about transition. I know we're preppers, we're off grid, we're thinking things are going to not provide us with hospital services. So what do we need to do? You know what? We'll talk about that in a second.
Yep.
I'm going to go to one more wound. Go ahead, honey.
Okay.
Okay, if you have a neck wound, because this is obviously not going to be able to be put a tourniquet on. Can't do that. You need to place a big gauze on it, and you need to put pressure. Again, just like the other one, don't delay. Get your gloved hand over the wound. If you have some of the gauze or packing, get that in there, okay, with compression. You want to push on it. You want to stop that bleeding. If you have a hemostatic gauze, you can put that in there too, okay? Nothing's going to be left in there that has to be picked out by a surgeon. You can get that in there. Push it in, hold it. Hopefully you've got something. If not, plain cloth. 3 minutes, just like the other one. And if you have a shoulder or a groin issue, again, not an extremity, you can do the same thing. Stuff it with gauze, put the pressure on. If you're talking about a wound on a neck, you can use the pressure dressing, but it is not wrapping around the neck. It's going on the wound, on the wound, and then down around the other armpit. Okay, so it's wrapping this way. Wound, armpit, and then back to around the back, across the front, wrap it. Or just stay on that one side. God, I hate looking at myself backwards. So this armpit and this side are going to get the wrapping. All right, if you have on a tourniquet, but you did not put on the hemostatic gauze because that stopped your bleeding, and you need to get this tourniquet on because your field hospital is too far away, you're going to need to do this yourself. The goal is to get them to somebody else so they do it. If you haven't put the hemostatic gauze on, now you're going to do that. You're going to put the hemostatic gauze on. You're going to hold it for 3 minutes. You're going to pack more gauze on top of it. And remember, filling up the wound so it's to the top. You're going to put on the pressure dressing, whether it's an Israeli dressing or a mini dressing, some kind of pressure compression dressing over it. Remember, you're covering your lasagna. Then, without removing completely your tourniquet, you're just going to loosen it a little bit. Leave it in place. because you might have to tighten it right back up. This is after you're pretty sure that the patient's stable, you're in the right place. You have to take it off. Time is ticking, and it's been long enough where you really think that they're okay. You don't do this 5 minutes after you put a tourniquet on. You're not helping the patient. And this whole take the tourniquet off, put the tourniquet back on, take it. No. We do not do that. When you are sure the patient's okay, in the right place, with the right equipment, that's when you're going to try to transition it. Just don't remove the tourniquet. You can leave it there even if it's loose in that area. And if no bleeding reoccurs, that's great, but don't take the tourniquet off for a while just to be sure. Common mistakes. I think you were going to do this slide, honey.
Sure. Well, I mean, common mistakes, very simple. Panic and hesitation. And most people wind up, you see somebody bleeding heavily on the street and gosh, they're absolutely paralyzed. So that's important. You have to do something. You have to act. You have to realize that somebody it may be dying. Not applying enough firm direct pressure because you're worried that you're going to hurt someone. Not applying pressure to hemostatic dressings for the required 3 minutes. They don't work necessarily very well if you don't do it for 3 minutes. Once they do it for 3 minutes, indeed, they work really well. And of course, hesitating to apply a tourniquet in the first place. Remember, it's obvious in arterial bleeding that a tourniquet is the first course of action in almost all circumstances. And of course, as Amy mentioned, loosening and retightening tourniquets over and over.
Yep. Okay. Is there anything that I missed that you want to add?
Not much there. Everybody should have some kind of bleeding kit. This is one of our bleeding kits with waterproof or bloodproof instructions, numbered steps, and things like that. We have that
in schools and churches.
That we've had in schools and churches. You will find them next to the fire extinguishers. Plus, of course, then we have more extensive ones that have chest seals and decompression needles and things that we're not going to go into too much detail for the rest of the day. So from our end, basically, here's some of our contact information. And we also are on, besides what you see written there, we are on MeWe, we're on PrepperNet, we're on, just about everywhere.
We have a Parlor account.
Parlor, right? Yep.
Now the Parlor's back.
Sure.
All right.
So
thank you guys for watching. And now we're going to put this down.
Yep, just close it out.
And answer questions.
Okay, there. Gets everybody back up front and center. Can y'all hear me okay?
Yes.
Okay. I had to take the headphones off. I couldn't hear you guys. Computer issues. First world problems, I swear. All right. I just posted a link in the chat. Let me share the picture real quick. This is their first aid grab and go ultimate pocket kit. It has everything you need to get you started. This is an excellent base place to start. Okay. You have to have a place to start. You guys know I have hounded first aid kits since before the first time I had this couple up here. If you don't have a first aid kit now, you're going to fall behind real quick. You're your own first responder. And if you aren't ready, then you're not a help to your own family, let alone anybody around you. So, I mean, you guys have seen my medical kit. I did buy the bag itself from these guys, but I filled the kit myself. It just took time. You don't have to go out and buy the $900, $1,000 kit you see all over the internet. And these guys have big kits too.
Yeah.
But you do have to start somewhere.
Yes.
Even if that means just taking, if you got insurance and it gives you $50 a month to buy, small things, use it. Buy a bunch of extra Band-Aids.
Right, health savings accounts and right, FSA.
Because I'm a first aid kit company, I actually can take HSA and FSA cards directly, and I provide a special receipt for people. Don't use the one that was sent on the email when you get it back, because they want something with my logo and my address and my phone and all that stuff. So I make special receipts for people who order with their FSA and HSA cards.
And this is one of their bigger kits.
Yeah.
And I'll tell you what, I've got a lot of what's in here with the exception of a few minor things, but I'm sure they'd love to see everybody here be able to afford one of these and add this to their kit. But I'm sure they're going to agree with me when I say start small and start building now.
Yeah.
With everything that's happening, and I'm not trying to cause fear porn here. I'm just stating the obvious. We've been talking, Gil and I talked last year that there was a shortage coming, and it hit. I said back then we were going to see a second round of this, of the Dragon, and we were going to see shortages again. We're starting to see them now because, they closed this pipeline here. Now nobody can get the gas for their vehicles, and now stores aren't getting their food. It's following a predicted path. So if you're not preparing now, you're already behind the 8 ball. Start somewhere. Start with something. Don't leave your family and yourself in dire jeopardy by not being prepared in any way, shape, or form.
Yep. All right. So it looks like someone asked, are there any differences with the gens of tourniquets? Yes. The cat tourniquets that I have are Gen 7, which is the most updated one. These people change them here and there. Like the Softy
is wider. The latest.
Yeah,
generation.
the later one, which I actually have over here, is wider. But where'd it go? I think I have it over here. And this was going to happen. I had all my stuff laid out, and now it's like in a big pile. Oh wait, no, it's over here.
Did you guys cover this one?
In the meantime, now the rat, is that a rat?
Yep.
The thing with the rat,
Yeah, this one.
Yeah, that one. Look at the rat tail.
The thing with the rat is that I don't really care for as much as can you see it? Is how thin it is. You see that? It's one of the easiest tourniquets to put on, but as you have to as you wrap it around more than once, you can really wind up getting a cord effect with this. Now, this is one of the reasons why it's not approved by the Tactical Combat Casualty Care Committee for use by the military, but it works perfectly fine. And if it was on for a short period of time, probably is just fine to have. I want to say there was a question from Bear about big hole situation. He's talking about an avulsion, what I cauterize. The thing, I use cautery in all of my surgeries, obviously, to stop bleeders and things like that. But the thing is with the type of cautery you're talking about would be essentially making a 3rd-degree burn on an area. So that would be really pretty much a last resort kind of thing for me. In my situation, with knowing anatomy at least and knowing where bleeding would come from, I would probably not do that unless I absolutely had to. And I think that if you're going to be the medic, that you need to know enough anatomy to know what blood vessels look like and how to find the origin of the bleeder, which is usually going to be the opening of that big hole closest to the heart. So that's what I'd say about that. But as I said, the rat is perfectly fine if you're comfortable with it. Things that I don't like about it is that it's just too thin. And before this was round, at least they flattened it recently.
Yeah.
But before it really was just like a cord effect, and that is just something that you shouldn't do. Really, these things should be about 2 inches wide, and they're not.
So I want to say something. If I had to make, where's the one in the package?
I don't know. Oh, here it is.
Thank you. If I had to make my tiniest kit, I would want a SWAT tourniquet, a pair of gloves,
A compression dressing.
EMT shears, and a compression dressing. That would be your cheapest kit. And then I would add, if you could, the smallest quick clot, because it's super tiny. So if you imagine these things,
and it's super expensive. They're all super expensive.
Quick clot.
But then again, you're saving a life, right?
Small one's not as.
You got to think of it that way. You're saving a life.
But you can pile this. If you see what I've done, I mean, it's not that big. If you look at my hand, so I've got a dressing, a hemostatic dressing. I've got a pressure dressing. I got a pair of gloves and EMT shears, and I've got a tourniquet. that I can use for a bunch of different things. So that's like my favorite tiny little kit. If you're going to go minimalist.
Kaylin, this, you have a rats. Would that be better used to secure a splint? No, this would be better used to secure a
I
splint.
love this.
You can make it into a sling. You can do a lot of stuff. It's $12. I don't know how much is a rats. Does anybody know?
I don't know.
$9 to $12 also.
Okay,
Yeah.
this is $12.
This is so awesome.
Much more versatile.
Oh my gosh, sling, ace wrap. I mean,
yeah, don't throw away your rats. Out there.
I mean, it's
definitely a useful
super
item.
Comfortable.
But you need to have some of these. And the other thing about these, I just wanted to say,
you're gonna say it fits on kid.
It works for children too.
I forgot to mention that
the military style tourniquets are meant for military style arms, but you can put this on a toddler and stop their bleeding.
Yes.
Or your dog.
There's one more thing you forgot to mention that's great for. Isometric exercises.
Oh yes.
Well, that's what
you can't break it.
It was what it looked like. I said it looks like an exercise band.
Yeah, right.
It's actually made from TheraBand. It's the same thing that slingshot companies use and exercise companies use. And there are different colors of it. The black and gold are the two strongest. So if you can't, for whatever reason, you can't find that, but you can find exercise bands in your local town at like a workout warehouse or something. Get a gold and black one or one of each, and those will work also. You're just not going to have the picture on it like that does in order to be able to do it.
Or you can
it's good. It's a good alternative. I don't know how much those are. I think I'm the cheapest SWAT tourniquet in on the internet.
But
they actually yelled at me once and asked me I had to bring it up a little bit.
You can also sacrifice this and make a half a dozen slingshots out of
it. Multi-purpose. I think someone had asked if all the tourniquets work well, and I would say absolutely yes.
Better to have them than not to have them. And better to have 2 or 3 than having one.
And I
have 3 in my kit.
This other one that I actually really love too.
We're after 9. How are we doing on time?
We're good.
Okay. This one's called Sam. Again, it's by that Sam medical company that makes the Sam splints. It works a little bit differently, but I really do love this. I have a video on each one of these tourniquets. I have a video on the SWAT tourniquet, a video on the cat, a video on the soft T, and a full video on the Sam XT. So you can watch me on YouTube show you all the parts, show you exactly how it's used. I also have a video that talks about the 10 critical principles of tourniquet use. So all of these myths that people have about tourniquets and the things that you really do need to know about tourniquet use is in that video. So if you want to learn more about tourniquets, I have that. We also have a series of 3 videos on that bleeding kit that you saw with the numbers. And the last one is an action film that Joe and I did where it looks like he got shot and I have to fix him. And I did that in real time. I didn't cut anything out. And I actually got really nervous, but I had to open up my bleeding kit. And I think I ended up using my teeth and then the scissors I had to use to open things up. So it just shows you, by the way, that once your gloves get blood on them, opening some of these packages,
next to impossible.
You're going to be doing this with the blood on your hand. So make sure, please, that you have some scissors.
Right. And possibly more than one, and preferably more than one pair of gloves. I have one thing else to say about the Israeli dressing is that it is double vacuum packed. Mm-hmm. So you may open this up and think you can immediately start using it. But no, what you're going to find is a clear vacuum packed plastic wrap around a second one. So in a lot of situations, I might consider opening the first one, leaving the second one, which is still vacuum packed, intact, so that I only have to open one and get to it faster.
At the time of emergency, yeah.
I'm going to offer up something too.
What?
I'm just going to offer up something real quick. This right here, let me turn it so y'all can read it. It's from the Ontario Knife Company. It's basically a multi-purpose cutter As you can see, it's got a blade right there.
Yep.
It's also got something right here to protect the skin. So
Yep.
this, something like this, a lot of people who have tactical kits get something like this to hang on their, their plate carriers. This will work also in as far as opening a package. It will work in removing jeans, most clothing, with the exception of some very heavy duty stuff where it's going to take a lot of force.
Mhm.
But it's the same with a pair of scissors.
Will it work on a
scissors-
seatbelt?
Yeah, this will cut through a seatbelt just like knife through butter.
Excellent.
These are excellent for that. These are designed to cut clothing. That's why it's shaped the way it is, so it can't gouge the skin. So if you have a tactical kit and you've got something like this in it, this is a good standby until you can get yourself a quality, keyword there is quality, pair of scissors. Don't go out and get the $5 Amazon specials because they will not work. They will fold on you the minute you try to use them on the jeans. They'll work great for cutting paper. They don't work good on jeans.
That's why I actually prefer bandage scissors for those. I just grabbed these EMT shears, but this has a rivet, but bandage scissors has a screw. And yes, there you go. That's what I prefer because you can tighten it up and you can sharpen them and they'll last forever. I have a pair that I got my first year of nursing school. Should I say what year that was?
Last year?
83. And I still have them.
And for those who are new here, who haven't been to my streams before or haven't actually met Doc Bones and Nurse Amy, they were on here about a month ago, and we did a who's who, so to speak, of who they are, what they're about, all links to their social medias. So go back in my playlist, and it's under all live streams, and you can find that live stream with them last month or a month and a half ago, something like that. Anyway, so you can get a better understanding of who these folks are.
Thank
I
you.
also want to tell you that it's important to have hobbies. Don't make prepping your only hobby. Here's my hobby, and here's my latest Bob Ross painting.
It's not a Bob Ross.
Looks nice.
Bob Ross.
So
he's pretty good.
Don't make it just about prepping.
Yeah.
Live your life too.
And if we haven't mentioned it, you're right. Kaylin brings up the fact that they are awesome authors. I have all their books that are in paperback on my shelf. I even have an autographed copy or two. I'm not going to say what, but so if you want good quality books, go ahead and check out their Amazon page. I think Kathy's already listed it once. She just listed the antibiotics and disease book. So go to
thank you.
Go
By
check
the way,
out the
thank you
books.
for all your kind words in the chat today.
Now I probably shouldn't say this, but the last time that I got a book from them, I ordered it directly off of their website and they autographed it for me. So I bet if you took the time and were polite and asked really, really nice and ordered it from their site, not Amazon, but from their site, and tossed in, a hug and we appreciate you, it's nice sentimental value, they might autograph a book for you too.
Absolutely.
Thank you so much. Absolutely. We're at any time. It's our honor.
Got anything there, Gil?
You good?
Well, just reminding everybody, I put it in the link there once. Tactical Tuesday will be starting in about 49 minutes on Gray Man Prepping, not Camp Pet and Family Compound. Gray Man Prepping, I put the link to it in there, and there it is again. So actually, that is the actual link to the live stream that's going to start in 48 minutes.
Good. So everyone can get a little break, go to the bathroom,
Stop
some water.
Stop the bleeding.
Stop the bleeding.
Yeah. Yeah, and as you can see, the topic is home invasion prevention. What's your plan? We're going to be talking about passive things you can do to protect your home. And we may, if time permits, get into a little more aggressive things. And we will be talking about, before we do that, about checking with the local authorities what you can and can't do in your area. Because there are certain things, certain states say, no, you can't do that. Others say, yeah, you can do that. So
I'm going to throw this out here, and I'm going to put a poll, seeing as how I have a community tab now. I'm going to put a poll up to see if we can convince this lovely couple to come back and give us anything else. Because, you know, if you haven't went through their podcasts, you could spend the next 6 months going through all their podcasts, not get it all in because they've got more than that much. So we'll see if we can convince them to come back up here and help us learn some more. Because you know what?
Yeah.
If you're not learning something at least once a day, you have failed to do your job. You need to learn something new every day. It keeps your brain active. That way you don't freeze. You don't become a deer in the headlights when trauma happens. You know, whether it be to yourself, to somebody else. Because, you know, if you're out there using your hoe and you're trying to get through, you know, the dirt and you catch a rock and it skips off and nails your foot, you don't have time to freeze. You have to get the shoe off, get it taken care of immediately, because even a small, or well, it wouldn't be small, but a cut in your foot like that can bleed profusely pretty quick, especially if you're standing on it and then getting off and standing on it. You need to apply the proper pressure immediately. You can't do that if you're not training your brain to not freeze.
You're 100% right. And you know,
You're a wise man.
All of us could go into the kitchen right now to make a snack and slice ourselves.
Well, what kind of snack are we having?
I don't know, but Gil's lost a finger.
Well, we're not going to be having finger food now.
Wait, did you bend that down or is that real?
He bent it down.
He's been caught.
That was good. Like he got me going.
I was thinking, you know, I don't remember that.
well, actually, my dad, the ring finger got taken off at just above this knuckle here.
Oh, wow.
In an industrial accident.
Wow.
Oh my gosh.
You know, you could be cutting watermelon or slicing chicken or who knows. It just, especially in the kitchen. I actually keep that SWAT tourniquet in the drawer with my forks and knives with the hemostatic gauze.
You know, one thing I didn't know.
Because I don't want to have to run across the house trying to find something. It's right there where the knives are, is where the tourniquet and the hemostatic dressing is in the same drawer.
Well, I want to thank everybody
cautious.
for having David having us, Gil, and everyone that we really appreciated. I hope I can get back to 2 lungs.
You'll be talking again soon, honey. Thank you guys so much for having us. And thank you for moving it earlier so he
Not
could
a problem.
save his voice.
I appreciate it. Thank you very much.
Very much.
No problem. So,
And everyone that came in late, you really need to go back and see the beginning of the presentation. At the beginning, set the stage for everything. You need to go back and see the beginning.
Yep. He's my professor. I'm the action girl. He's the professor.
all right,
That's a good thing.
With that being said, I want to say thank you again for you two coming up here. It's always an honor and pleasure to have you guys up here. We always learn something new every time. And with that being said, we're going to go ahead and shut it down so everybody can go find their little restrooms and get themselves something to drink and wind up back over at Gil's in a little while. Until next time, be safe. God bless.
Thank you, guys. God bless.
Bye-bye.
Bye.